Good morning, good evening, everyone. So today we have our former student, Dr. Venus Sharma, who matched this last year, and she's going to discuss some useful tips on application and the residency interviews that you can expect. She'll give you a perspective on what programs are looking for and how you should structure and articulate your responses, both in the application as well as in the interviews. So welcome, Venus. Glad to have you here.
Thank you so much, Pawan. Good morning, good evening, everyone. Thanks for giving me an opportunity to share my experiences with everyone. So, hi, everyone. As Pawan said, I'm Venus Sharma. I'm from Punjab, basically from India, and matched here in New York this year. So, this is my second application season in which I matched. I went unmatched during my first season. I made a lot of mistakes in my first season and I overcame those. So here I am today and I'm ready to share my experiences with you all. Thank you, Pawan.
So let's start with your perspective on application. So, now, of course, there is application, there are LORs, and then we'll get into the other aspects, the interview. So application and personal statement. How do you think, what are some of the tips you have for the applicants on these things?
So, in my opinion, personal statement and application is like the face of the applicant. They don't know you personally. The programs, they don't know where you come from. What have you done so far? So, they will come to know you from your application and from your personal statement, like what kind of a person you are personally and professionally. So, you have to articulate your responses and your answers in a personal statement and in your application very, very specifically, and you have to think very logically before writing your application, because application is the most important thing in USMLE journey, and which I feel as an IMG I was not aware of during my first season, which I came to know about in my second season. So you have to use like small nitty gritty things, right, in the application, that you have to use bullet points. Always specify what you did during all your electives, during your rotations, use of specific words, use of pronouns, nouns, and all those things. These are very important when you write your application. And more than that, know your application. What have you written in your application? Because during the interviews, the program reads your application very, very carefully, and they can go ahead on just one point, what you have written in your application and personal statement, and make you talk about it for good 15 minutes. So, knowing all the responses you have written in your application about your elective, about your volunteer work, even about your hobbies. So be ready to talk about them for good 2 to 3 minutes. And even your personal statement, what kind of a person you are, they will come to know from your personal statement. So I feel that these two things, your application and personal statements, is very important in this journey. Yes.
Okay. Talk to us about importance of US clinical experience and maybe even step 3. But first, let's talk about the US clinical experience, because at the height of the COVID, you managed something that not many other applicants did, which was, in the US, you managed some USCE, which last year was very, very amazing. So talk to us how programs look at the USCE.
Yes, so they are very, very interested in the USCE. So I did 4 USCE in my season one, but the mistake which I feel I did in season one was not doing anything during my interview season. So in a way to overcome all those things, the mistakes which I did during season one, I tried to work during the interview season as well, even during COVID, because that was my big mistake which I did during season one. So firstly, they're very interested in knowing how many electives you did, where you did, and what were your responsibilities. So why they want to know all those things is because they want to see whether you will be able to adjust to the US system or not. Because as an IMG, we come from a different system where we don't have an EMR, we have some lot much paperwork as compared to US, and a different system, of course. So they want to make sure that you as an IMG know the US system very very well, and you know what are the differences, so that it will not be a big shock to you coming from a different countries, right? So secondly, during my interview season, I was working here. I was doing observerships. I did during the entire season for a good 3 months. And during my interview seasons, they were very interested in knowing that what are you doing right now. I have been through a good number of interviews, and each and every one asked me, like, are you doing something right now? So what are your responsibilities now, right now? So it means they were expecting us to do something during the interview season, right?
Right.
And even personally, I feel that it gives an opportunity to talk to them, and they will remember, oh, this person was working during the interview season as well, and she talked to me about these things. So I feel USCE was helpful to me in that sense. I talked to them about this for good 7 to 8 minutes, and they were very happy knowing about it. And not just about USCE. I was not only doing rotations. Apart from that, I was writing a case report and everything, and they asked me about each and everything. So I feel that is very important during interview season to keep working, so that they will remember it, that, oh, that girl was working during the interview season. So yes, that has
So,
helped me.
okay. Now, before we move to the actual interviews, what are
Mhm.
your views on step three?
I cannot emphasize much more on the importance of step three. That is the most important thing as an IMG, which you have to give. Even if you have a good score, even you have average score or low score, step three is a very important thing. So you always have to keep in mind that before application or during the interview season, you have to give your step three, because during the ranking system, so they will make a list. So even if a student is at 260s, suppose, but he has not given step three, because they have to eventually pay for step three once you are into residency. And then when you have given step three, and even if your average scores like 250 or 230s, they will prefer you. You're automatically above the student who has 260s in their steps. So yes, so step three is very important, and it doesn't matter if you have done research or how good your USC is. The step three is having its own value, and it is very, very important. So as an IMG, just get done with your step three just like any other step.
Okay. All right. So now let's move on to the actual interviews. And, last year was all virtual. Even this year will all be virtual. So talk to us about your interviewing experiences, what programs expect, what type of questions, the most common questions you heard on the trail. And then we'll talk about how applicants should structure their answers. So first, let's talk about your experiences and what the programs are expecting of the IMG app.
So, in general, firstly, I would like to say that interviews are the most important part. Again, I would say just don't take it lightly that now you have an interview, which means that you are matched into a program. No, it's not like that. And I've heard people saying that just be yourself. It's don't stress too much about it, just don't take too much stress about interviews. But no, it's not like that. Interviews are a very important step. You have to take interviews very, very seriously, and you have to structure your answers according to the program. There are some community programs, so you have to structure your responses according to their requirements, and there are some university programs, the big programs, and then you have to structure your responses according to their requirements, what they are looking for in a resident. So that was the mistake which I made during the season 1, and which I overcame during season 2, was to structure your responses specifically for the needs of the program. So suppose you have 20 programs, right? Read through each and every detail of the program, what they're looking for, what not. Write down your responses. Keep on, practicing your responses in the mirror using a timer. They should not be less than 2 minutes, but they should not exceed 2.5 minutes. So these are some of the details, nitty-gritty things which I followed and which helped me a lot during season 2. And about the top questions which the programs ask. So the first and foremost questions will be, obviously, tell me about yourself, because they want to know where are you from, which school you graduated from, what are you doing right now. So I feel that you have the power to lead your interview, like, so tell me about yourself. You can say that, oh, I graduated from this school and I'm doing this right now. So they will be very interested to know what you are doing right now and what your responsibilities are right now. So in that way, you can discuss about all those things. So tell me about yourself is a very, very important question, and you have to be very, very, cautious about the words which you are doing in tell me about yourself and what you are answering them in that question. Sometimes that is everything in the interview. And secondly, the other important questions I would say is the strengths and the weaknesses. What are
Ah,
your strengths? What are your weaknesses? Then, third most important question is tell me about a mistake which you did in your med school. So these are some of the major questions which they ask. And thirdly, I mean, the next question would be the behavioral question, how you responded to a conflict, how you dealt with the difficult patient, and all those things. So these are some questions which they ask, which are very common, and you have to be prepared with some story. But it should not, you should not go rambling about one scenario and everything. It should be very specific, but to the point answer so that they will remember, oh, he talked about this and this case. Try to be very specific and personal to it. And I would say always try to talk about something with the interviewer so that they can remember, oh, that girl talked about this thing. Yeah. So that, the common interest which you may both share, try to talk about it. Try to build some reputation with them so that during the ranking season and everything, they will remember you that, yeah, that was the one girl who talked about this thing and everything. So, yeah, that's something which is very important. And here, I would also like to talk about the career timeline thing, which is very important, the program outreach and all those things. So you have to be very specific even before your interview and after your interview. As don't leave the program after the interview. You have to keep on emailing them, even try to give them your career timeline. This is something which Sarthi panel will teach you, how to build a career timeline and the importance of career timeline. And that has helped me a lot. Even after my interviews, I was in touch with them, talking to them and everything.
now you had also mentioned that they read each and every line of your CV and PS, and in the interviews you have to lead them to the next question, right? That's something. So tell us, why students should pay special attention to even writing their volunteer activities and some of those things which otherwise they may really not pay attention to. Were you in those interviews where they actually read your CV and asked you questions?
Yes, yes, I have been a part of those interviews where they read a line from my personal statement and told me to elaborate on this. So I clearly remember that in my personal statement, I wrote one experience of mine from one of the elective which I did here in US. And one of the program directors from one program asked me, right, you wrote about this experience. So tell me about it. How was your experience? What was the person suffering from and everything? So all the details they asked me about that thing specifically from that program. And he asked me all the other things about that program, like how was your experience in that program, like what you did in that program, how many patients you saw every day there. So knowing what you're writing is very important. And about my volunteer work, even one of the program coordinators, I would say, she asked me about my volunteer activity as well, like what was your responsibilities during that volunteer work and how you managed everything and how much funds you rose. It was a non-government organization and we were working towards raising funds, and specifically like how much funds you rose and how many children you helped. So those things are very important. Volunteer work, I would say hobbies are very, very important. So always write your hobbies, keeping in mind that you are supposed to talk about your hobbies as well. It's not just a column you have to fill, you have to talk about it.
Now, let's talk about how Sarthi helped you in your entire journey. Just brief.
So I feel that USMLE is a very, very long journey and you have to be very patient. And the most important thing is you have to have a mentor. Being an IMG, we don't know the tiny details of USMLE. So to have a mentor, to have someone to guide you is a very, very important thing. So USMLE Sarthi was a true Sarthi in my journey. So they have guided me through the tiny details, how to write your application, how to be grammatically correct. They have gone into my application, I mean, I would say 2 to 3 times, and they have given me feedbacks on it that, this word is not, even on the tiny words, they have given me feedback that this word is not right. You have to write it in a specific way. You have to be more meaningful, use this much bullet points, don't ramble on this point, just be specific about it. So writing down your application as an IMG is a big challenge. So as an IMG, we come from different countries where we have more responsibilities and more patience. So we technically have worked a lot, but we don't know how to write that on a piece of paper. So that's where USMLE Sarthi has helped me to writing down, what were my responsibility. As an IMG, we have done internship, right? 1 year of internship. So you have to write that 1 year in a very, very interesting and logical manner so that it is helpful to you during the process of USMLE. So I would say, firstly, they have helped me to write my application in a very, very impressive manner. So well written application and personal statement, as I said earlier, is a very, very important thing. So number one in that. Secondly, having a mentor who is there to guide you and push you through your weak points is very, very important. I was personally very scared to give step 3 because I didn't want to get a low score, but everyone pushed me a lot that no, you can do it and you have to do it to apply this year during your second season. So yes, step 3 was very beneficial. And the program outreach, just don't write a generic email to every program saying that I'm interested. No, how to write an email, the first paragraph should be what, second paragraph should be what, third paragraph should be what. It should be specific, small, and to the point, yet very, very specific to the program. So those things which I didn't know, USMLE Sarthi taught me that how should you do program outreach and how specific you should be about it. And the most important thing was the interview skills, I guess. They give you the database to prepare everything. They will tell you what programs are looking for and the mocks. I cannot emphasize the importance of mock interviews. So mock interviews have helped me a lot. There are 5 mock interviews which you get, and anytime you can call Pavan. He's there to listen your dramas all the time. So yes, that has helped me a lot. And yes, because of all the efforts and I would say a good mentorship from USMLE Sarthi, I managed to match in such a good program, I would say.
Well, the hard work was all yours. So I remember in New York at the height of pandemic doing your USC. So it's your hard work. Uh, so this was good. Very, very good overview of the type of preparation students should be doing in these seasons, whether they are applying in this season or the next. Anything that we missed? Any parting suggestions?
Yes, again, I would say step 3 and your interview preparation. Just don't be yourself, always structure your responses and be specific to what program is looking for and practice, practice, practice all the time.
Uh,
Yes,
well, thank you very much, Venus. Much appreciate your time. This was very, very helpful.
no problem. Anytime. And thank you for giving me an opportunity, Pavan.
Thank you.